My name is Brad Hagan. I'm currently an associate professor at the University of Lethbridge in their School of Health Sciences. The way we set up the educational videotape series is the most likely scenarios that students would have to encounter. The first thing we want to show students is some of the common errors or some of the small, subtle mistakes that students might make when they first try working with these people. So we thought it'd be really helpful just for students to maybe see themselves as novice students and some of the things they might run into problems with. And then the second thing we'll see is a second scenario where we see a more expert or a more proficient nurse and some of the skills, the advanced skills that he or she might bring to that scenario. One of the more important aspects of the work of mental health nurses is to continually monitor their clients' mental health status. By mental health status, we mean such things as their mood, their thought patterns, their speech, their appearance, their way of communicating, and also such things as their suicidal ideation or potential for violence towards others. Sometimes this mental status assessment is done formally, such as if the nurse was assisting the person being admitted to an inpatient psychiatric unit. In other cases, the mental status assessment is done informally, such as during a conversation or perhaps even a ping pong game. In this first vignette, you're going to notice a nurse who's attempting to complete a mental status assessment with a very challenging client. This client is uncooperative and very difficult to engage with. You'll notice the nurse does simply not have the skills and knowledge to make an effective mental status assessment for this difficult situation. In the second vignette, you'll notice the nurse is also making a mental status assessment with this difficult situation, but she's using much more of her assertiveness skills, her confidence, and her advanced skills and knowledge to perform as thorough an assessment as the situation allows.
Hi, my name's Sue. I'll be doing your admission with you this evening. Thanks for waiting. Did you get something to eat?
I'm not hungry. Where's my doctor?
Well, she should be here within the next hour. Now, can I ask you a few questions?
It better not be Harris.
Pardon?
Harris! My doctor, it better not be Harris. I want McLean. McLean was my doctor last time. I don't want no goddamn Harris coming near me.
I don't actually know who your doctor's gonna be. We just put the call in.
Well, I'm not asking who my doctor is. I'm telling you. I want McLean as my doctor. Now get on the phone.
Christy, I can see how this whole thing is upsetting to you. Your admitting physician put a call into the doctor on this unit, and I'm sure when they come, you can talk about your preferences and they'll...
Yeah, right. What a load of crap.
Okay, well, can I ask you a few questions then?
Like I have a choice. But you want to diagnose me? Look, I'll save you the trouble. They called me manic depressive, major depression, schizoid, borderline personality, which is my personal favorite. What the fuck does that mean? Borderline personality? Ah. Look, did you get it all? Are you done?
I don't really want to try and diagnose you. I want to find out how you're doing overall.
Overall? I'd say overall, not so good. Like last night, I was bleeding from my wrists like a pig because I cannot cope with the fact that they want to come and take my son away from me again. And before that, I'm dealing with AISH and social services because I can't afford to pay my rent for 2 months and they're gonna take my apartment away. And living on the street is really gonna help me keep my son. And then I get this call from my best friend who's in the hospital who may never walk again. So, overall, oh, did I tell you that they're gonna come take my son away from me?
I'm really sorry. Like, it sounds like a lot. Like,
How the fuck would you know? You with your little nursey job and your little nursey life? This is fucking bullshit. I don't want any more questions. Where is my fucking doctor? Look, just fill out the form. Just write exactly what they wrote the last time. It's always the same. I've been in here enough times. You can just write what they wrote the last time. And get on the phone and get McLean.
Christy, as I mentioned before, you can talk about that whenever it is who comes to see you is here. They should be here shortly. Now, can I just ask a few more quick questions and then I'll let you
I
rest?
told you, no! Write down exactly what they wrote down the last time I was here. It's just the same shit. It's just a different day.
We can't really do that. We need admission data each new time you come in.
Data? Is that what I am? Just write down that I'm suicidal, I'm uncooperative. What else do they call me? They call me inappropriate. I'm inappropriate. Just write down that shit and leave me alone. And where is my goddamn doctor?
So, you mentioned that you were suicidal.
Yeah, I'd say cutting my wrist so I'm bleeding like a pig is pretty fucking suicidal. Yeah?
So, what about right now?
Like I'm gonna tell you. I tell you, and then you tell my doctor who's gonna come in, and then they put me in here for a month, and then I have no fucking chance of getting my son back. It's like a game. You guys are all so sick.
So how about your mood then?
What the fuck? What a stupid question. What about my mood? What do you think my mood is? Oh, it's great. Oh, I just can't help remembering that I was sexually abused for half my life. And I have no idea where my son's father could possibly be. But things are just ducky. I'm great. Do you have any other stupid questions you want to ask me? What the fuck is wrong with you people?
No, that's it. I'm done. I'll come back later.
Don't bother. Just get my doctor.
Well, I'll let you know when she gets here. Is there anything else?
Shut the door.
Hey there, Christy. My name's Sue. Hi, settling in.
Into jail? Yeah, I'm getting pretty cozy in my little prison cell here. How come no one's been here to see me? Where's my doctor?
Well, I know it can seem like forever before someone comes in, but your doctor's been called and will hopefully be here soon. Now, in the meantime, I have a few questions that I need to ask you, and it might help pass the time.
Well, it better not be Harris. There's no goddamn way I'm even talking to Harris. I want McLean. I want McLean as my doctor, who's my doctor last time. I want you to get on the phone and get McLean in here.
I honestly don't know which doctor's going to come see you first this evening. Now, if you have a preference in physicians, or if you have a regular physician that you see, you can let that be known at the time whenever he comes.
There is no way I'm going to see Harris. I'm not even going to talk to Harris.
Christy, I don't know who it's going to be right now. And I actually don't want to waste either our time or energy talking about who it might or might not be. Now, I have some questions I need to ask, so the sooner we get started, the sooner we can be finished.
Well, it might be a waste of time for you to talk about what doctor I get, but sure the hell isn't a waste of my time. You know, I'm just not, I don't know if you heard me, I don't know if you're listening, but there's just no way I want that jerk Harris as my doctor. I want McLean, I want you to make a phone call and get McLean down here. It's my legal right to get a phone call, and I want to get on the phone and talk to McLean, or else you're gonna get sued.
Christy, I believe you've been through admissions enough times to know that unfortunately that's not the way that things work here. Now, I hear you loud and clear. You want McLean and not Harris. I will pass that information on to your admitting physician. However, it's ultimately up to you to make your wishes be known to the physician at that time. Now, that's all I'm going to talk to you about physicians, because that's honestly the best that I can do for you. I do have some questions I need to ask to make sure you get the best care while you're here. So, Christy, what was going on for you that led up to this admission?
I told them everything in the emergency department. Don't you guys talk? Have you ever heard of a telephone?
I know it seems like we might not talk to each other, and I can see why you're worn out and frustrated by this whole process. But since I'm the one that's providing care for you and the one that's going to plan your care while you're here, I want to hear it from your own lips rather than someone else's. So, what's been going on? Looking at your wrists, you've either been cutting to reduce stress, or you've been trying to end it all by committing suicide. What's up?
Well, last night I just thought, what is the fucking point? You know? I cannot cope with them trying to take my son away. And then those idiots in the government holding back my AH payments, and it's like I'm gonna end up on the street. And then there's no fucking way I'm gonna have my son. And then I got this phone call from my friend from the hospital, and my best friend's been in a motorcycle accident, and she's probably never gonna walk again. And then I keep having these flashbacks. Fucking flashbacks to my abuse. And it's just like, fuck, how much am I supposed to take? You know, how much can a person take? And it's like, I don't even fucking care anymore, and I can't imagine why you would care. I can't imagine why anyone would give a shit.
Well, believe it or not, I do care. As long as you're my patient today, I care very much what goes on with you.
That's just the fucking point. It's just like, the second your fucking shift ends, you forget all about me, and it's just like back to your own fucking great little life.
Christy, with all due respect, this isn't about me. For right now, in this moment, I do care about you, and you have my complete and full attention. So, how are those thoughts coming? Those thoughts of just wanting to get it over?
Do you think I'm fucking stupid? Do you think I don't fucking understand this stupid little game? If I tell you I'm feeling suicidal, you're gonna go tell whatever doctor they send, and he's gonna come in here and he's gonna fill out a form, and I'm gonna be here for another month or more. You know, I know the Mental Health Act. I know how it all works, and there is no way I'm gonna get my son back like that. Fuck, there is no fucking way I'm gonna play your stupid little game.
Look, I can see why this seems like a game to you. And I can certainly appreciate the fact that this might affect you seeing your son. It's perfectly understandable. That being said, Christy, this isn't a game. This is about keeping you safe and keeping you alive so you can see your son again. Now, if you really do want to see your son, you have to work with us. I mean, really work with us to make sure that you don't try killing yourself again. And part of that work is letting us know how your suicidal urges are going.
This is sick. This is a trick. You're trying to trick me into telling you something, and then you'll tell the doctor and he'll fill out a form too, and I'm going to be in here for 30 more days.
Okay, Christy, well, what do you think? How are we going to solve this problem? Where we try and balance your fear of us using whatever you say to keep you in here longer with the need to keep you alive through this crisis so you can see your son again. How do you propose we solve that problem?
I don't know. I just don't know who to trust.
I know, I can appreciate how hard it must be to trust any of us. But if you want to get out of here, get better, and see your son again, your very best chance is to work with us. Christy, I can see by the difficulty you're having answering my questions that you probably still are having some suicidal thoughts. And that's perfectly understandable given that your attempt was just last night. Am I right? Okay, well, let's just assume that most people in your situation would be pretty suicidal. Okay, and for the time being, let's just forget about all that mental health act. We can deal with that later. We have to focus on the most important things, which is obviously your depressed mood and your suicidal thoughts. Now, given that your number one object here is to get out of here and see your son, what do we need to do about the business of your suicidal thoughts to keep you safe?
I don't know what the fuck you're talking about.
Well, some people don't just have suicidal thoughts. They actually have a plan on how they'd commit suicide. Now, for you yesterday, that was trying to slit your wrists. What about today? Do you have a plan or a way of trying to commit suicide while you're here on the unit?
I don't know. Like I'd tell you.
Well, is there anything you might do to commit suicide? Anything hiding that we didn't find?
Duh, like I would tell you if I did, you just take it away.
Christy, it seems like you're the one who's playing games now. Look, I'm here to help you stay alive and see your son. That's what you said you wanted. Now, in order to do that, I need to know if you are having any plans of trying to commit suicide on the unit in the next few days.
No.
Honestly?
Yes. I mean, I'm not gonna try.
But if you did have a way, let's say someone gave you razor blades or something like that, would you tell us or would you try to commit suicide?
These are fucking stupid questions. How the hell am I supposed to know what I'd do if I don't even have anything?
Okay, well, we'll just say you're not sure. We'll leave it at the fact that you don't currently have the means to try to attempt suicide, but you may be at danger if you do find the means. So then, now how's your mood? What are you feeling like?
I fucking hate that question. What good is it to ask me that 10 times a day?
Well, I'll put it another way then. How's your mood on a scale of 0 to 10? 0 being pretty much rock bottom, such as during your suicide attempt. And 10 being your normal self, feeling great?
I've never felt great.
Fine. 10 being the best you've ever felt then. So how's your mood right now from 0 to 10?
Well, seeing that I'm in this place and I have no idea what's happening with my son or my finances or my friend in the hospital, I'd say it's like a 1. You happy? Now you know how low my mood is. You can keep me here for another month.
Okay, well, that's still pretty low. Overall, is there any time of the day that you might feel a bit better?
Oh, fuck. Can we just stop this? No. God. Just enough with these questions.
Well, what kind of questions would you find helpful?
I don't know. I want to be left alone. I want to know where my doctor is.
I can appreciate the fact that you want to be left alone. I know, we can finish most of that later. But I do have one more question that I want to get started on.
What?
Well, it's just that while you're here, I want you to feel like you're working on some of the issues that have been causing you stress. Now, you mentioned a few things like your son, your finances, your friend's accident, sometimes of when you were having sexual abuse. Now, that's a lot to deal with, obviously, and it's pretty unrealistic to think that you can deal with all of that at the same time. So then, while you're here, what do you think the biggest thing that you need to deal with is, right now, before anything else?
Well, I guess I need to find out if I still have a place or if I've been kicked out of my apartment. To see if whether I have a place to live or if I'm on the street. You know, I need to talk to my landlord.
Okay, so the housing thing is a pretty big priority. What do you think the biggest thing is that we could help you with that?
Well, I mean, I need to go and I need to speak to my landlord and see if he said something about if not paid by today, then I'd be out on the street. So what I need is for you to let me go. And I need to go and I need to go and I need to see my landlord and I need to get out of here.
Christy, due to your suicide attempt and you're still high risk at suicide, I don't think it's realistic for you to leave the hospital right now. However, can I make a suggestion about your apartment?
What?
Well, I'm going to call Dave, our social worker, and I'm going to explain your whole situation to him and see if he can come up and see you. Now, there might be something he can do if you just give him a bit more information on your finances and your landlord. Would you be willing to talk to him?
Yeah, whatever. Fine.
Well, has anything else helped other than this?
No.
Okay, well, it looks like Dave's your best bet then. Now, you have to be willing to work with him. Now, are you going to be willing to work with him? Christy, it's up to you. It's your decision if you want to get help or not.
Yeah, fine. Whatever.
Okay, well, I'll take that as a yes. I'm going to call him and let you know what's happening as soon as I know. I heard you say something about wanting to be left alone, so I'm going to go and check on my other patients, but I will be back to ask you a few more questions later.
Fine. Where's the phone? I'm sick of waiting here. I want to talk to somebody about getting out of here.
There's a phone for the patients out on the wall by the shuffleboard table. Just please keep your call to 15 minutes or less.
I'll talk as long as I need.
Well, if after 15 minutes you're still on the phone and a patient needs to use it, you might be asked to get off. We all have to extend the same courtesy to each other. Well, we'll talk to you later, Christy.
One of the more important aspects of mental health nurses' work is continually monitoring their clients' mental status. In the first vignette, the nurse simply does not have the skills and knowledge to make an effective mental status assessment with this difficult client. In the second vignette, the nurse uses a lot more confidence, assertiveness, and advanced skills to perform as thorough an assessment as she's able to in this very challenging situation.